Over time, the role of the oncology pharmacist has evolved in a very exciting way. When the role of the pharmacist was mainly to check chemotherapy orders and to just prepare and dispense, now they've become more involved in the actual decision making and the support of patients. So the journey starts off with oncology pharmacists checking the patient's home medicines, making sure that they're eligible for chemotherapy, looking at their comorbidities, contributing to the decision of what chemotherapy or what SACT really, what systemic anti-cancer treatment would be more suitable for the patient, including precision medicine, so looking at their genetic profile, looking at the molecular testing of their tumors, and then coming up with a decision that is, or coming up with a regimen that is individualized for the patient. And then once that decision is made, the oncology pharmacist is also responsible for making sure that all supportive care is prescribed adequately. So for example, looking at what antiemetics the patient needs based on their metagenic potential, looking at other types of side effects that can happen like hypersensitivity or diarrhea, pre and post chemotherapy, so that's also the role of the pharmacist. Also counseling and educating the patient on what to look out for, how to handle their side effects at home, because our role is to make sure that the patient gets the most out of their medicines and they stay on their medicines, because that's what's going to guarantee their overall survival. The minute patients get severe toxicities and interruptions or dose reductions, then we are compromising the overall survival. So that's part of the job as well. And then other jobs as well that pharmacists do is coming up with guidelines to support other members of the healthcare team, so that they can prescribe safely. They also lead clinics, so as prescribers, oncology pharmacists see patients from cycle 2 onwards, and then if the patient's labs are all within normal limits and there aren't any severe toxicities, then the pharmacist makes the decision to prescribe cycle 2 and all the supportive care. So it's really a huge range of things that the oncology pharmacist is involved in.